Okay, this is Christen. She's a 44-year-old patient of ours that came in May because she had a car accident back in May. So this is filmed October 10th, 2018. Kristen's coming in for soft tissue injury, joint fixations called subluxations, whiplash. She's had issues, and she still does, with her low back, neck, a lot of headaches, right, Christen?
Yes.
Okay. And is there some jaw issues too sometimes?
Just light, yes.
Okay. I think the main problem here is the headaches and the neck pain and the stiffness all the way down her back. So today I'm going to do some soft tissue treatment called Gua Sha. We're going to use a Gua Sha comb and with some lotion, which is, we like to use Sombre here at Living Pure, and some Mahanarayan oil, which is from Banyan Botanicals. This is an Ayurvedic oil filled with spices and turmeric and highly anti-inflammatory, if you could see that there. So this works really well too. Okay, so this oil is pretty runny. I'm going to apply just a bit here. I've protected her as much as possible with paper towels to protect her clothes. Remember, this contains turmeric, so it's going to stain, especially if you're wearing white. Gua Sha Therapy is a soft tissue therapy used in Chinese medicine, sometimes with acupuncture treatment. I like to use it for a lot of acute and chronic stiffness, stubborn knots in the shoulders and neck, among other areas. So we do a light scraping using this comb. And what you're looking for is more circulation, and you'll find the skin starts to turn pink right there. That means it's working. So we're flushing out the stagnation, getting rid of the toxic substances that form when there's inflammation, especially due to injury. So Christen, I want you to tilt your head to the right, slowly. And I get a little more intense up here. A lot of her pain is up in the suboccipital region, right under the cranium right here, under the skull. And her headaches seem to stem from here, right?
Yes.
And they go across the temples?
Yes.
Okay, come on back to neutral. And then I may go a little more aggressive right down here. Of course, I'm holding the camera with one hand, so I'm trying not to shake the camera as I'm doing your therapy. How are you feeling?
Good.
Good? Do you feel the heat?
I do feel the heat.
Okay, good. Tilt one more time. Perfect. And then back up to neutral. Okay, Christen has involvement on both sides. Left side's pretty puffy before we started. It's still going to be puffy after Gua Sha because it brings heat to the area. So she's going to be instructed to drink lots of water, take some magnesium as well. So we're going to get into the other side. Christen, what side is the pain most? Do you feel the pain mostly?
Right now on the right side where you're at.
Okay, but normally, like before you came in today?
Before I came in, it's sort of on both. It's both sides, but this was the right side today.
Okay. And you had a headache that started about, what, an hour before you got here?
Mm-hmm.
Okay. Tilt your head to the left for me. I like to incorporate action or active movement by the patient while I'm doing this therapy rather than doing it passively. I think the patient responds better to it as they're lengthening the muscles. How are you feeling?
Very good.
Does it feel tingly?
Tingly and a little tight.
Okay. Okay, and that's it. See how red the skin is here? This is fresh. This was done maybe, 2 minutes ago, right? Okay. Okay, tell me how you feel now.
I can feel the heat. It feels a little less tight than it did.
Okay, so let's have you tilt your head to the right. And then the other way. Okay. Does that feel different?
It does. I feel like I'm more restricted going this way.
Mm-hmm.
But I feel like I can go a little.
Can you open up more that way? Mm-hmm. Okay, so on the left I went deeper into the suboccipitals, but not so much on the right. So we're going to get up in here. And sometimes I'll do manual therapy using my thumb. Doing okay?
Mm-hmm. It's sensitive, but it's not bad.
Good. And that is the introduction to Gua Sha Therapy that we like to use here at Living Pure, especially for auto injury patients that come in with, whether it's acute and they can't be adjusted right away because they're so stiff and sore, and sometimes subacute and chronic, like Christen's now in fourth month of treatment, so she's sustained quite a bit of damage here, but she's coming along nicely. Sometimes there's going to be a hiccup or a stumble, right?
Yeah.
Especially when there's stress or anything like that. One bad sleep on, bad position can set you back a little bit. So there you go.